Hello everyone, this is Chris from Market Street Financial Group and agentchris.com. I wanted to take a few minutes today and walk you through the process of finding a Medicare Part D drug plan on Medicare.gov in 5 minutes. It's very simple, and we're going to jump right in. First things first, go to Medicare.gov. So this is the official government website. You're going to need to go to www.Medicare.gov. Okay, once you're there, you're going to click on this yellow button that says Find Health and Drug Plans. You really don't need to know what you're doing here, folks. The Medicare.gov drug plan finder is going to lead you basically right through. All you have to do is answer a few quick questions. First thing they're asking you here is for your zip code. We're going to go ahead and put in Westchester, PA, zip code 19382. There's also another search field down here that will ask you some more specific information, but this is really not necessary to get started. We're just going to click on Find Plans. It may or may not prompt you to enter your county. For now, we're going to put Chester County. Depends on your zip code. And you can see here that we're step 1 of the plan finder. So again, just answer the questions. How did you get your Medicare coverage? Do you have original Medicare? Are you in a Medicare Advantage plan? Do you not have Medicare coverage yet? Or do you just not know at all? So for this example, we're going to assume that we are on original Medicare as opposed to Medicare Advantage. It's going to also prompt you to put in a few other things here. I also have a separate drug plan. I also have a Medigap plan. These are optional questions. For now, we're going to leave those blank. Next question, do you get help from Medicare or your state to pay for your Medicare prescription drug costs? Only you would know the answer to this, but for the example that we're doing today, we're going to put that we do not get any extra help, so it doesn't kind of skew our results here. Click on Continue. And step 2 is going to be to enter in our prescriptions. Okay, so if you don't take any prescriptions, chances are you probably still need to get a drug plan so you don't pay the penalty, and also to protect yourself from future exposure. If you are put on a drug in the middle of the year, you're going to want to have a drug plan. But for this example, we're going to assume that we do take prescriptions. So let's go ahead and put a few in. As you start to type, Medicare.gov will recognize what drug you're attempting to type in. It will begin to pre-fill the name for you. For right now, we're going to put in lisinopril, and the dosages, quantity, frequency, this will all pop up automatically. So you're going to go ahead and put your dosage in as far as your milligram, your quantity. Do you take 30 per month, which is 1 a day, or more than that? So for now, we're going to leave everything on default. We're going to say that we take 10 milligrams once a day, 30 pills every 1 month. Pharmacy type, don't worry about this for right now. Just leave that on default. Add drug and dosage. Okay. So we have lisinopril. Let's add another one. Crestor. These are just examples. 10 milligram, 30 a month. Leave it on default. Just click on Add Drug and Dosage. Let's add another one. Toprol. 50 milligrams once a day. Add drug and dosage. Okay, so here we are. It's shown us that there's a generic available for this medication. Again, only you would know whether or not you're taking the generic. You may want to check with your doctor to make sure, but taking generics can save you a lot of money. So for this example, we are going to select the generic. Obviously, the generic version might not work or jive with you. For now, we're going to put that we do take the generic. Click Continue. Okay, so we have 3 meds in here for now. We'll leave it at that. As you can see, it will show you in the field here that if it's a generic or if a generic is not available. So you can see that Crestor, there is no generic currently available. Lisinopril is already generic, and we selected the generic version of the Toprol. My drug list is complete. It will now prompt you to enter or choose a pharmacy that you generally prefer to go to. This can be changed later, but for now we're just going to assume that you go to CVS Pharmacy here on Westchester, Wilmington Pike. You can pick 2. for now we're going to pick one. And right here is where you can kind of expand your selection of pharmacies. You can search within 8 miles of your zip code or go down to 1 mile, so it shows you a selection of pharmacies that are closer to your property. We're just going to select CVS, click on continue. Okay, step 4, refine your plan results. Okay, you have all this stuff to the left. Okay, don't worry about this for right now, just ignore it. For right now, again, because we're basing this example on original Medicare, we only want to search for standalone prescription drug plans. So prescription drug plans with original Medicare. If you were on a Medicare Advantage plan or you were searching for a Medicare Advantage plan, you would select this one or this one. For now, we're going to check original Medicare. Click to plan results. Okay. And you can see that Medicare.gov will automatically sort these plans in order of lowest estimated annual cost. In fact, you can sort them a number of ways. If someone was going to enroll in a drug plan in the middle of the year, we would typically sort these by lowest remainder of the year retail or lowest remainder of the year mail order cost. For now, let's assume that you are enrolling in the middle of a year. We're going to select lowest remainder of year retail costs, assuming that you're going to a walk-in retail pharmacy. Select that and click on sort. And Medicare.gov's plan finder will automatically sort the plan for you. So it will show you the cheapest plan or the plan with the lowest, annual cost at the very top. So for our example, based on the 19382 zip code and that CVS pharmacy and the prescriptions that I entered in, the First Health Part D Value Plus is showing up as the plan with the lowest rest of year cost. So if you look over to the left, okay, forget all this stuff over here. Look over to the estimated annual drug cost. It will show you the annual cost as well as the cost for the remainder of the year. Now today happens to be the 4th of July, 2013. So it's calculating what the cost would be for the remainder of 2013. Okay, so $434 is the estimated annual drug cost. Now this $434 is an aggregate of a number of different things. It includes the premium that you pay each month, which for this particular plan is $28.20. It includes any applicable deductible. For this plan, there is not a deductible. A lot of them do have deductibles, but for this one, there isn't one. So it calculates all that information for you and shows you, what the total cost would be. So really, this is the only number that you really have to pay attention to. Who cares what the premium and the deductible is? You really are basing your number on your total annual cost or remainder of year cost. Okay, so you can scroll down the list and see there's other plans that are very close. This one's $482 compared to $434. You have the AARP plan, which is $534. So just don't pay attention necessarily to the premium. Sometimes a plan with a higher premium might actually have a lower annual cost because there might not be a deductible or there might not be any co-pays or the co-pays might be lower. So don't get caught up in the premium or deductible part, okay? Make sure you're looking at the total cost because at the end of the year, that's the important number, okay? The next thing you want to focus on is drug coverage, drug restrictions, and other programs. So look over here to make sure that, number one, are all your drugs on this particular plan's formulary? Well, yes, they are. Are there drug restrictions? Yes. So this is important. You want to look at this column to make sure that your drugs are covered, and if they are there any restrictions? So let's just click on that real quick. Okay. And it will automatically show us what the restrictions are for the drugs that we put in. So you can see over here that for the Crestor, there is a quantity limit. And what they're saying here is this particular plan will not pay for more than 30 tabs every 30 days. So if you take more than one a day, you are going to pay for that out of your own pocket if you select this plan. Not every plan has this restriction for Crestor 10 milligram, but this particular plan does, okay? So because we only take one a day in this example, this restriction really is a moot point. So we're going to move on. Now, if you wanted to actually enroll in this plan, you could enroll right from here by clicking this enroll button. If you are like me and you want to get some more details on the plan, you click the link and it will open up a detailed, basically, analysis of the plan. So let's take a quick look at this. Now, the premium is showing is $28.20. There's no deductible. It's showing you what the cost is based on CVS's pharmacy, full year and remainder of year. And then we get down to the what you pay section. So they're showing you here what the list price of the drug is, how often you're refilling it, what the initial coverage level is. Basically, this is your copay amount for your drug. And then it shows you other information just so you know what your cost would be if you hit the coverage gap, aka donut hole. Okay. It also shows you what your cost would be during the catastrophic coverage period, which is after you get out of the donut hole. Okay. For this particular plan, based on the cost of our medicine, we're not going to hit the donut hole, so don't pay attention to these two columns. You really just want to look at this column right here, initial coverage level. Okay. So you can see that your copays total up to be $58.69 per month. Okay. So because we're in the month of July, the remainder of the year, you're going to multiply this $58.69 by the remaining months of the year, and then do the same for the premium. Okay, that number will equal approximately $434.45. So Medicare.gov has done that math for you. Okay, so you don't have to break out a pencil and paper and try to do this yourself. Medicare.gov is calculating all the information you need to know for you. Okay. So this chart right here will show you what your 12-month drug plan enrollment will look like, and also what the remainder of your year will look like. So because we base this example on the remainder of year, it's only showing us the month of August, September, October, November, and December. So it's only showing us 5 months of data, which really that's all we care about, because open enrollment's in October. Whatever change we make in October takes effect January 1st. And so, therefore, this is really what we need to look at right here. You can change your plan during open enrollment. So you can see that your monthly breakdown is going to be about $86 a month. Why? Because it's calculating your copays plus your premium. Okay, so the $58.69 plus the $28.20, they're rounding up a little bit to $86. If you scroll down further, it's going to show you, basically the information that you already saw on the previous screen. They're kind of trying to add everything together here. You can also print the plan report if you want a detailed copy. This is typically what we do for the client. We'll print this report out for them to show them, in writing how the plan works. And folks, that's pretty much it. This was a pretty easy example. Obviously, the more drugs you're taking, the more complex this decision could be. You really have to examine these things. When you're ready to enroll, you just click the enroll button. The screen's going to pop up that will prompt you for some other information. They're going to ask you, why you're enrolling. So for this example, we're going to assume that you're new to Medicare. So scroll to the bottom, continue, click on I am new to Medicare. There's also a number of other scenarios that could have played out for you. Maybe you lost coverage through an employer, whatever. For now, we're going to click I'm new to Medicare and click on continue. From here, the basic information, name, date of birth, gender, Medicare number, phone number, address, all that stuff. And we're going to kind of stop the tutorial here just because I'm not old enough to enroll. So I don't want to put in a bogus enrollment. But from here, there's only a couple more screens. You click another button and you're enrolled. Medicare will enroll you in the particular drug plan that you selected, and you'll get a packet in the mail from the drug plan within usually 10 business days to, I've seen it take as long as 20 business days. It depends on when you're enrolling. If you're enrolling during open enrollment, there's millions of other people doing the same thing, so it tends to get bottlenecked a little bit, but that's really all there is to it. I know this took a little bit longer than 5 minutes, but it usually takes me between 2 to 5 minutes to enroll somebody in a Part D drug plan. So if you have any questions, feel free to comment or go over to my contact page. I'd be happy to help you out. And that's it. Thank you very much for watching, and you enjoy the rest of your day. Take care.